I was fascinated during my education with how things worked in the natural world. I became particularly interested in disease and why some individuals will develop these dreadful diseases where the immune system actually attacks itself. And in fact, my mother suffered from one of these very serious diseases, lupus, and I saw the results firsthand of somebody living with such a chronic disease that would come and go but has a slow decline. And there are really not very many treatment options available to these patients.
Seeking to understand, that's certainly what motivates most researchers. Finding the answers, identifying the avenues to explore, that's how these scientists invest their time. Fiona POWRIE was always fascinated by the body's immune system and by the vital role played by the intestines.
We have been trying to understand how the immune system lives with trillions of bacteria in our intestines, and in most situations that is of benefit to us. It helps us with our nutrition, it helps us in host defense, but again in some individuals things go wrong and we start to attack our immune system. And our work has identified a population of immune cells that can prevent this. And we know in inflammatory bowel disease patients, some of them, there are changes in this pathway that can cause terrible disease. So we want to now understand what are the signals that are coming from our intestinal bacteria that actually influence the type of immune response that develops in the intestine, with all of the effects that that can have on health and disease in terms of the gut.
Through her work, Fiona POWRIE has identified the regulatory T cells. In most cases, it's the interaction between these cells that allows the intestinal immune defense system to function properly. Shortcomings in T cells' functionalities lead to numerous chronic inflammatory diseases affecting the intestines. Fiona POWRIE and her team set up their laboratory here at the John Radcliffe Hospital at the University of Oxford in 2009 in order to take research forward and to identify new avenues for the development of enhanced therapeutics. These laboratories are right next door to the hospital's gastroenterology unit, a close, unique bond, one that offers a wealth of opportunities to learn.
We were looking in gastroenterology in Oxford for somebody who could take the academic basic science lead and to complement my lead of the clinical service. And she was great. The interaction, the chemistry which motivated her, which motivated me, seemed the opportunity to bring things together. And she has a remarkable ability to put people both at their ease, but also to get the best out of people. She is able to speak clinically, even though she's not a clinician, and she speaks the same language. She's interested in working out how disease originates, how it continues, and how acute inflammation develops into chronic inflammation. And that, of course, is absolutely the language I speak as a clinician, and giving us the potential to work together, collaborating to drive the science, which Fiona drives, and the clinical side, but to bring it together in the translational gastroenterology unit. And it's the translational science which is the motivating factor for the entire unit.
So a lot of things is about timing, and I think this is the right time to try to translate our findings. We have to be right in the clinic, and we have a wonderful set of gastroenterology colleagues who have been very positive about us rather naive basic scientists coming in and trying to study what's going on in these very complex diseases.
The research teams working in the experimental medicine division of the John Radcliffe Hospital have a real advantage, that of being in direct contact with patients and the disease.
I used to be a mouse immunologist, and then like 3 years ago maybe, we started to work in the human. So basically translating what we knew from the mouse into the human. So being in this hospital, it's very nice because you are in a close link with all the medics. You know what operations are going to take place, if we need some samples. You can actually just go down to endoscopy and have some contact with the patients, with the nurses. So it really puts your work into contact, and you really feel like you are doing something to alleviate human suffering. Which is, I think, the nice thing of working in the hospital. You see the human face of your science, which I think is really nice.
I think you're closer to the patients maybe. So we also at some point we were watching patients or talk to the patients as well, and you get more of an impression how important it is to work also in the basic research, and see how important it is for the people, for the patients who have this disease, and so it makes a bit more sense altogether, I guess.
Actually, that is one of the unique things, that there is basic immunology, that there is basic scientists together at the same level with clinicians, and not only adult gastroenterologists, but I'm a pediatrician, and pediatric gastroenterology is as well under the umbrella, because we can learn from pediatric onset intestinal inflammation. Some of those children are severely affected, and we try to understand the basic genetics and the basic mucosal immunology in those children as well.
Fiona POWRIE, who's also Professor of Gastroenterology at the University of Oxford, opted to establish her research laboratory in this hospital. All those who have come to know her well over the years agree that her ability to take the right decisions at the right time and to have good people working with her certainly contributed to her success.
It's not only how good you are, but you've got to pick the right things, be there at the right time and the right place. And she's made some very smart decisions from the very first one of the supervisor she chose. And because she was out of science, she was an accountant before she came back to science. So I thought she'd be successful, but I wouldn't have predicted this successful.
There's a lot of very bright people who do science, and they reach a high level in science, and they're admired by other people for their intellect and so on. And Fiona certainly has that in abundance, but one of the things that makes her a bit different is that she has a very good way to deal with people. So managing people, different personalities, is not easy, and I think Fiona strikes a very good balance on how to deal with people, how to get the best out of people, how to be positive with people, and really motivate them to do well.
In work, as in everyday life with the family, for Fiona POWRIE, it's all a question of balance. A difficult task, but one she manages without any fuss, as her colleagues and friends agree.
Fiona's far from boring. I don't know how she manages to pack in everything she does into her life. And she's got a fantastic sense of humour. You know, there's a tremendous amount of warmth with Fiona, and she really does care about people and look after people. You know, she's always concerned about things that are going on in the lab. She's concerned about her family, and she looks after her close friends very well.
I am a positive person, and I enjoy what I do. I have a wonderful team of people. It's not just me. I mean, I'm the name that's being recognised as part of this award or our work, but actually there are many players that come together to make this a productive operation. On the family side also, I could only have a family if were it not for the efforts of my husband, who's been enormously supportive as we work together. I think again as a team, all of this is teamwork, being able to combine this and that. I wouldn't be without any of it, really. I may have to give up some bits as different aspects change, but having the children is a wonderful plus.
Fiona POWRIE has two daughters aged 10 and 15. That's a full-time job too, one which she accomplishes with a love not dissimilar to that she has for science.
Just a couple of weeks ago, I went into my daughter's class at primary school, so this is a bunch of 10-year-olds, and I took a book that had been written by somebody we know called Germ Stories, and it had cartoon illustrations of all of the bacteria that are good and bad. And they asked parents to come in and read. So rather than reading a story, I went in and read them about these goodies and baddies that lived in the intestine. And it was great because there was loads of, oh, that's horrible. And it was wonderful to communicate that excitement. And I do discuss it with the family, although I think it's quite nice to turn to other things. And I don't bring too much of my work home into the house, other than what I'm actually doing. But Otherwise we are talking TV programmes or sports or something like that.